Welcome back, and thanks again for tuning in to Tea Time with
Liz and Calvin, and special guest Dr. Paul Lemal.
Hello.
Definitely glad to have you. We're here filming live at the Hyatt Regency in downtown Greenville. So Dr. Lemal, give us a brief bio of your background.
Okay, very briefly, I started in pre-med in oh boy, I'm going way back. Let's see. My dates, oh God, I'm screwing it all up. Okay, wait a minute. Residency 78, 74. I started pre-med in 1969, where I thought I wanted to be an engineer, but after a year I didn't go into engineering and switched to pre-med. Graduated in 1973, and then from 73 to 1977, that's when I went to Medical College of Ohio in Toledo, followed by 5-year residency of 1 year of internal medicine and 4 years of OBGYN in Cincinnati, and 2 years of private practice after that. And beyond that, for the past 30 plus years, I've been working with a large HMO in Southern California.
So, Dr. Lemal, is it safe to say that you're smart? This is where we're modest.
You can always say, was I smart to do all these years?
Okay, he's going to be modest.
Glad,
he's going to be modest. As you can see, ladies and gentlemen, he has a long list of things that he has done to get where he is. And I can tell you he is a personal friend, and he's a hard worker. And I'm sure he's very excited with helping people, and he does a wonderful job. So this show is definitely geared to sort of cater to you women who have some questions about pregnancy, about different preventatives that you can, different steps that you can take to make sure you have a healthy pregnancy. And I think Liz has some incredible questions for Dr. Lemal today.
For sure. I mean, when I go into the OBGYN once a year, they can't get me out. I mean, they're like, okay, you'll be fine, just go. Everything's good to go. But I do have a large list of questions for you.
Sure.
Well, not really large list.
Okay.
She's going to paraphrase.
Semi-long.
Yeah.
Semi-long, okay? My first question is it true, this is the rumor, that birth control leaves you 100% more susceptible to sexually transmitted diseases versus if you weren't on birth control?
No, it's probably about the same as if you were on birth control pills or not. They don't offer any more or any greater protection or unprotection from sexually transmitted diseases.
Okay. And what is the healthiest / safest birth control for women?
It probably needs to be tailored to the specific woman, but I would say if a woman is probably in her teens or 20s and has no medical contraindications, then I would probably offer a low-dose birth control pill. But that's my own bias, and the reason is because of its effectiveness compared to other forms of contraception.
Right. Effectiveness being like towards pregnancy, or just effectiveness against?
Effectiveness, or let me put it a different way, is the failure rate.
Okay.
All contraceptive measures have some form of a failure rate, some percentage. With birth control pills, as long as a woman is taking the pill as directed, it's about 0.1 to 0.2% failure rate. Versus an IUD, which can be anywhere from 2 to 3% failure rate. The biggest failure rate, but still offering protection, would be condoms, which have a 12 to 15% failure rate.
But I mean, the thing about it is, I'm scared about taking birth control because when I look online, they say people who have history of breast cancer shouldn't take birth control pills.
Well, if the person herself does not have a history of past breast cancer, I think that would be fine, that she could go ahead and take the birth control pill.
Okay.
It does not increase that. In fact, the literature suggests that women who are taking birth control pills are protected in later years from getting ovarian cancer.
I heard you say herself. Are you saying that only women can get pregnant?
You never know. This is the 21st century.
Right. Do we not
I mean,
know?
we were sort of diving there. I said, let me lighten the mood a little bit. No, I got kind of... But I do have a question as well. Tell me something. What... a woman in her 20s versus a woman in her 40s to mid-40s, do they face different challenges or potential challenges as far as trying to have a child?
Oh, so we're not on contraceptive now. We're on fertility. Is that what your question is?
Absolutely.
Fertility potential.
See how smart he is? Like, it just switches that quick.
Okay,
He's good.
The best time for a woman, and this is textbook. This is since I've been in med school.
Listen up, young girls.
And what they say is the most optimal time to have a baby is 20 to 29, period. When a woman gets to be 35 and over, there starts to be the increased chance of having reproductive difficulties, getting pregnant, and also the possibility of a miscarriage may be increasing. And that is arithmetic with age, going, 36, but if you're 40, it's even a higher risk. 44, even a higher risk than a woman in her 40s.
Well, what about the people from 29 to 35? What's that little...
They're fine. They're most likely fine. I was just quoting what a textbook said to me.
Well, Liz, you're... Okay, well, she was asking, you're getting into your 40s. Liz is getting into her 40s, so she's getting afraid. But as you can see, Dr. Lemal let you know that it's too late, so just don't worry about it. No, but anyway.
No, I did not say that either.
The textbook.
So you spoke about something earlier. You said something about the higher risks for miscarriages. I do want to ask you a question about that. What are some of the signs if you're a pregnant woman and miscarriages? Do they likely happen at a certain time, or do they? You know what I mean? I guess miscarriages don't. I mean, I don't know if I'm asking that correctly, but.
Sure. You can have early miscarriages, which are generally the first 8 to 10 weeks of pregnancy. And you can have later miscarriages, which can go up to as high as 18, 19 weeks of pregnancy.
What are some of the... Go ahead, I'm sorry about that. When
we refer to miscarriages, the usual time is less than 12 weeks if the event is going to happen. And you were asking about signs or symptoms?
What are the symptoms?
Well, we don't usually use the word signs. Symptoms are basically some light spotting to severe cramping, heavy bleeding, and a little bit of light spotting might indicate a threatened miscarriage, not a full where everything resolves, no problems with the pregnancy or with the baby. But the more a woman bleeds and cramps, the higher the likelihood that she will miscarry.
Right. So, can I switch subjects just a little bit?
Sure.
Do you mind?
No, not at all.
Well, okay, we love this question. This is for the men and the ladies because the men like this question too. What are some foods that I should eat to help the smells down there? Or what food should I avoid?
You mean, are you talking about a vaginal discharge?
No.
No, you said the smell down there.
Okay, well, because they say that pineapples make it smell good down there. So I was just wondering, do you know, can you lead me in the right direction of what foods I should avoid before oral intercourse with someone, or what foods I should lean towards?
I would say, everybody's body chemistry is very different.
Okay.
And we all react differently to different foods. I would stay away from the quote-unquote exotic foods, spicy foods, garlicky foods, foods that one woman will react to more than another. I would say around that time, maybe some of the most boring, blandest foods you could eat, like plain pasta with a little bit of marinara.
Right.
But nothing in the extreme.
No,
I apologize. She said men would appreciate this question, so I'm like, oh, okay, let me hear about it. But yeah, ooh, that was pretty deep.
Well, I mean,
but just so, foods react to different people in bad breath. One person taking a type of food is going to have worse breath than another.
Right.
Or what we call halitosis.
Okay.
So,
So we're not. It's not like pineapples. You're A-okay. Okay.
No. It's different. It's individual body chemistries.
Okay.
Yeah. And you see how Dr. Lemal just handled the question so professionally, like
He did.
yeah.
If a woman does have a persistent odor,
Oh,
she
God.
should seek out her gynecologist and be examined.
Right.
And have cultures taken, and many times we look under the microscope.
Bro.
But it's true now.
No, it is absolutely. It is absolutely true. I was making eye contact with my cameraman. I didn't know if he was going to let us know if we needed to take a break or what. No, I'm just kidding.
We're
We don't
flowing
need.
quite nicely over here.
No, absolutely.
I'm getting a lot of knowledge over here.
Yeah, we know about smells.
Well, okay, so what about marijuana? If you're smoking marijuana, does that decrease fertility?
We really haven't had that many studies thus far to really say A causes B. We have different levels of evidence, A, B, C, D, where A is definitely A causes B. But
Right.
we're unsure of that at those different levels.
What is those levels that do cause infertility?
Oh, well, no, that's different. There are causes of infertility.
Right.
That's different from the levels of
Oh, okay.
studies or anything of that nature.
Okay.
So, causes of infertility are many.
Many.
40% is caused by the male. His semen could be not enough, or he could have immobile sperm. Having a lot of sperm that's immobile is just as bad as having no sperm at all,
Right.
because they have to travel. But getting off the subject, other causes of infertility are a woman not ovulating regularly. So we give her a fertility pill. It could be blocked tubes from a previous history of what we call pelvic inflammatory disease, initiated by an infection called chlamydia. And I know I'm going off the tangent,
No.
but this is why all women 25 and under should be cultured for chlamydia. Because they tend to, we want to make sure that they are optimal, at least they don't have underlying chlamydia, because it may be without symptoms.
Right.
And we want to capture those women in the reproductive group who we would not want them to have blocked tubes.
Exactly.
And that's what the sequelae could be as a result of that.
So all women who are sexually active,
Mhm.
as soon as they start, should go ahead and go to the OBGYN once a year.
Probably. We don't do a pap test until age 21, but if she's sexually active younger than that, she should come to the OBGYN just for a routine exam, a discussion of contraception, and finally to rule out chlamydia or gonorrhea.
Once a year, ladies.
Also, on a side note, Dr. Lemal was talking about the semen may or may not be mobile. I think you said something.
Correct.
So I think it's imperative that all of you go out and make sure your semen has a car, whether it's certified pre-owned.
He just feels so left out with this OBGYN talk.
Whether it's certified pre-owned, make sure your semen is mobile. And if you have a little bit of money, step it up. Get an Escalade.
Semen isn't mobile. Spermatozoa are
Spermatozoa.
mobile.
Make
Right.
sure it's mobile.
mobile. Okay.
Right. Listen. Okay, wait. Because you just playing. I need real
I'm not.
information.
Listen. I'm looking out for the guys. I'm like, I want to make sure the semen is mobile. If it's a scooter, if it's Uber,
It's sperm, not
Sperm.
semen. Semen
I mean sperm. That's
is
what I
the
meant.
liquid that holds the sperm produced by the prostate gland.
Okay. Make sure your sperm is mobile.
Listen. Okay, so I just had a baby. I really didn't just have a baby. But let's say I'm a woman, just had a baby. Is my elasticity affected?
Well, I would say probably there is more relaxation of the vaginal mucosa or the vaginal lining. And the more babies a woman has, depending on the size of the baby at birth, how long she's been complete. By complete, I mean dilated, fully,
Right.
how many hours, all of those, and also genetics. All of these interplay to cause or a loss of elasticity.
Right.
Or a better term would be prolapse or vaginal outlet relaxation, as we term it.
Right. So then now my elasticity is gone, so I want to go get some vaginal rejuvenation. Is that safe?
We generally in the community don't recommend vaginal rejuvenation per se if it's causing significant symptoms of relaxation. And by that I mean when you go to the gynecologist office and there is a bulge of your vagina coming out at the opening, whether it be the back area of the vagina or the front or the bladder or the uterus, you need to have that repaired. Right.
Fix that.
But do we do vaginal? It is vaginal corrective surgery, but we need an indicator. We need the woman to complain.
It's not safe to just get tightened?
No, it's perfectly safe to do that. But if she's having significant symptoms, sure, she can do that.
Right.
Can you just put cocoa butter on it?
For a whole thing falling out of the thing? Now picture that.
No.
Wait a second.
A hole is falling out of itself.
Wait a second. When you were talking about a bulge, what
Picture that.
Yeah.
Bulge
You're not
of what?
picturing it.
Okay. You picture the opening of the vagina. It should just be an opening, and that's what it normally looks like
A flower.
anatomically.
Flower.
But imagine when a woman comes to your office and you see a bulge of pink tissue coming through. Well, that is what we call prolapse. And it comes as a result of previous childbearing and genetics.
That is scary. That is scary. Okay, one last question for me. I know he might have some more.
No.
I'm growing I'm 28 years old.
Mm-hmm.
I am growing increasingly more hormonal around my menstrual cycle.
Okay, define hormonal.
Ooh. I can't. This chick. No, I'm just kidding. Go ahead.
No, I want to hear what.
I just think that sometimes I live life as a free spirit. Surely I take things seriously when they need to be taken seriously. But I feel like Elizabeth is a little more serious a lot more of the time.
Well, maybe it's because you're a guy.
Right. Is your whole stuff
See,
look,
you don't have
you
don't have a pink bulge.
No, it don't matter.
But she could after 5 kids.
Let me see.
You don't even know. They have a pain thing for men that we could hook him up and he can feel what menstrual pains feel like. You don't even know what those pains
Yes,
feel
I do.
hormonal wise.
The other night, my quad started cramping. And that is
Women is
equivalent.
really gonna be in the comment section.
That is equivalent.
Women really gonna about to be in the comment section.
That is equivalent to a baby. That is equivalent to a baby.
Now,
do not. We might have to edit
not to
out.
deviate. I'm going to set this in motion so we don't deviate. I want to answer your question.
Yes.
And what you're probably referring to is what we call premenstrual syndrome.
Right.
And usually that occurs when a woman feels like she's getting more moody, for lack of a better word, bitchy, her mood swings are up and down. Then I ask her to do a menstrual calendar. And by that, symptoms of bloating, irritability, moodiness, pain. When is that most likely occurring? Usually 7 to 10 days before the onset of her menses.
Ding, ding, ding.
And again, that is due to fluctuating hormone levels, which men do not have.
I was told at one point that men do have a menstrual cycle. It comes in a form of stress or depression. Is that true?
Well, yeah. You can still have hormones fluctuate, but theirs is in a predictable manner, and this is why we give them a menstrual calendar.
For
and
sure,
we want
every
a phase.
month.
So basically, anytime you have to issue a calendar for someone's emotions, don't you think don't you think they need some extended therapy?
It's a good question, Calvin. It's an excellent question, because if she deviates with the moodiness and mood swings during any other phase of her cycle, it may be anxiety disorder, depression, so it may not even be hormonally related. She may have stress factors causing that, loss of a loved one, moving to a new place, and that could be stress factor which is tied in with depression, having nothing to do with premenstrual tension.
Oh.
So is it because I'm getting older and my body
Not
wants a
necessarily.
baby?
Not necessarily.
Okay.
What I tell women with premenstrual tension, stay away from the sweets. You should have only complex carbohydrates. Endorphins from exercise really help a woman. Motrin for the breast tenderness that can accompany all of this.
Right.
Motrin for the cramping that can accompany all of this. And take it on as needed basis. Multivitamins, they may be associated with it. Years ago, we used to think putting them on birth control pills would help premenstrual, but that's been refuted now. You would think that because you have that constant hormone level, you're not going to have the mood swings. Well, not necessarily so.
Right.
Well, all seriousness, I was not making a mockery of your assessments. I really wasn't. I was actually, my job is to sort of bring light.
Well, I don't study men, so I wouldn't be able to tell you that either.
Oh, you don't?
So, no, we
Okay.
don't. That's
Absolutely.
the purpose of an OPGN.
I get it.
Women
I
only?
totally get it.
We're
So,
special.
Liz, I think, honestly, Liz, do you feel that Dr. Lemal really put some things in perspective for you?
Yes. Especially the birth control part.
Yeah.
Because I've always feared being on birth control.
So those of you ladies out there who are, hopefully you've taken a lot away from this. I think Dr. Lemal has been overly kind, giving us the information that the women need and that they want to hear. And for the men as well, because I think men should definitely try and educate themselves as much as they can about women's pregnancy. Of course, there are some things that we just don't understand, some things that we don't want to hear. Right, some things that we just don't want to hear about.
And I'd like to add on, too, when we were on the method of talking about contraceptive, particularly for sexually active teens with multiple partners, don't just be on birth control pills. Have a condom in addition to that.
Mm-hmm.
Because birth control pills do not protect against STDs.
Right.
They don't make STDs worse or more susceptibility, but women with multiple partners need to have a condom in use.
Right.
In the prevention of STDs.
Don't be afraid to carry your own condoms.
Yeah, absolutely. So as you can see, that's definitely an educational thought. Dr. Lemal, we really want to thank you for taking the time to come on the show.
Very welcome. I'm honored.
Liz and myself, we were very excited. I think Liz, as you can see, Liz, could you show them your cards, please? No. Liz.
I only had 9 questions.
No, but she did. But seriously, Liz definitely did her research and she had some questions. I know our shows in the past have been, sometimes comical, but as you can see, you can take a lot away from this, even though I was being sort of a jerk a little bit, but
no. Just yourself.
But I want to personally thank you for coming on the show. Thank you very much.
Yes.
It's been an absolute
Elizabeth?
pleasure.
Thank you.
Sure.
So,
Thank you.
ladies and gentlemen,
Woo!
thank you again for checking in with us, Liz and myself, with Tea Time with
Liz and Calvin and special guest Paul Lemal.
Dr. Lemal.